I'm going to be talking a little bit about what medically necessary definition is. I'm going to talk a little bit about the wellness and prevention definition that we're working on. And then I'll give you a very speedy update on our specialization professional practice groups initiative. In sake of time, unless there's a burning question, just come up to me afterwards if you don't mind. I'll be here throughout the lunchtime. As Brenda and Damon have mentioned, insurance companies are increasingly looking at us as far as costs, and we're have a major target on our backs because of the amount of claims that are going in through extended health insurance companies for massage therapy. And it's a good thing and a bad thing, or a bad good thing. I think it's a bad good thing as far as this increased focus on us, is that it sharpens us, it weeds out issues that we have in the profession, etc., and makes us a more efficient in our clinics. And so, as an example of an insurance requirement, each plan with each company, with each union, with each department can be different as far as what they stipulate. But what we're seeing is there's an increased requirement in most of these extended health plans that the services are medically necessary. And I'll read you one here, and it says, the supplementary healthcare plan covers you and your dependents for eligible expenses, including paramedical practitioners. And then there's a whole bunch of other words in there, and then it says benefits are only payable for expenses which are medically necessary. And that is a terminology that we're starting to see more and more as we start building more and more companies. It's not the insurance companies that want to diminish the use, it's actually the payers, the companies and the unions that are paying for the plans. They're saying, okay, why is massage therapy way up here and chiropractic and physio way down here? Well, because everybody loves us, so how can we try to even out, or putting the medically necessary in there, they're sort of limiting what their members can use their benefits for. And so we have an option as a profession. We can leave it up to the insurance companies, we can leave it up to the medical doctors to define what is considered medically necessary for our profession, or we can claim that territory. And that's what we did as far as creating a medically necessary definition. Another thing that's happening quite a bit as a result of what we already said is that insurance companies are increasingly conducting audits of the claims that they pay out. They are calling up clinics, asking for information. They're sending you forms to fill out. I know one RMT called me up and said in one lump sum they got 7 forms from an insurance company for 7 different patients that they had to fill out, and they were 3 or 4 pages long, all kinds of questions. And the therapist said, well, I need to charge for this. And the insurance company said to them, well, we're not paying for it, so you can bill the patient. And the patient said, well, I already paid you for the services. So here we are in an area where insurance companies are scrutinizing us because they have no definition, because they don't understand the processes. The other one is what I've heard is they want a treatment plan from you. Blue Cross, for example, is very big on that. They want to see after you use with RCMP, it's 20 sessions a year, I believe, and then you have to show a rationale, more than just a medical referral. You have to show a rationale, a treatment plan for continuation of the therapy. And many of these therapies have been denied. So 20 sessions, and then they deny them because the lack of treatment plans and lack of medically necessary rationale behind the treatment plans. So one could say the free ride of extended health care insurance is over for us as a profession, and we have to start self-monitoring a lot more what we are providing to our patients. And that's sort of where the medically necessary definition and the new definition that we're working on of wellness and prevention. Trying to find a definition for the services we provide to our patients, so the insurance companies, the employers and the unions that are paying for it understand what they're paying for, so they could choose to provide both, or could choose to provide just medically necessary or just the wellness based. So it's an option for them to do that. So the medically necessary definition you have in your folder for today, but I'll read it out for you. Medically necessary massage therapy service is one that a patient needs in order to avoid negative health consequence. Now, again, it's fairly broad, and we sort of define that in the second statement. It says, medically necessary or medical necessities shall mean healthcare services that a therapist exercising prudent clinical judgment would provide a patient for the purpose of evaluating or treating an illness, injury, disease, or its symptoms. So rather than trying to pigeonhole what type of therapy you should do, what kind of illness you should do, we're saying use your clinical reasoning, use your clinical skills, and come up with a rationale. Why are you working on this patient? How did you come to that conclusion? For an example, I had, let me see here, ICBC case. There was ICBC liaison called me up and said, this therapist recommended this course of action to one of ICBC's claimants. And it was against what the ICBC adjuster was recommending. It was against what the medical doctors were recommending. And she said, well, I said, within the scope of practice of this therapist to do this, and they thought it was outside of that. And I said, well, have you looked at the clinical reasoning behind this therapist's actions? And they hadn't. And so that's your fallback whenever there's a dispute between you and a third party. What was your clinical reasoning behind it? And that's really what medically necessary is all about, is just putting it in plain language and sort of concise language, what that really means. And so when the insurance company falls back on looking what is this medically necessary therapy that you're providing, it's not that it's something that a medical doctor would use. It's more sort of the generally accepted term of what medically necessary is. And so the third bullet point underneath that is the standards of care, and that's really taken directly out of our standards of care from the CMTBC. So this should not be anything new to you. And so I'll let you just read that over yourself. Now, as far as the wellness and prevention definition, we're still looking at that, and that is going to be a bit of an issue. Yeah.
A question here based on medical necessity. Once a patient reaches the medical maximum improvement, is there anything in the definition related to that?
Yeah, well, that is when you purpose of evaluating or treating an illness, injury, disease, or its symptoms. So if there are still symptoms that you can manage and you are improving the patient's quality of life, then you would be able to continue with that if you're showing a continuation of improvement in quality of life or maintaining. So you would have to do a trial. You remove the service or the therapy and see how the patient does on their own. And if they go downhill, then you have an argument for continuing with that. So it sort of depends on how restrictive you want to be with medical improvement. Does that make sense? So back to the wellness and prevention, like I said, it's going to be a bit of a minefield to try to figure that one out for a couple of reasons. One is, what is wellness? We can look at the World Health Organization definition of wellness, which is quite broad. You're looking at sociological implications. You're looking at psychological implications, etc. So it's going to be a challenge, I think. And prevention, we talk about preventative massage, but what really does that mean? Because I can tell you from the literature right now, most preventative things are not really preventative. As far as, for an example, runners, and giving them appropriate shoes based on their foot mechanics so they won't develop injuries. Based on the last couple of years and the studies that are coming out, there is absolutely no support for that, and it's quite to the contrary, that giving somebody motion controlled shoes based on supination, pronation is not going to prevent their injuries. And so the logical conclusion from that and other studies that are coming out saying, well, I'm going to massage this person once a month to prevent injuries. Well, you have to take into all the different factors that could cause a person injury. And so for us as a profession to go out there and say we're providing preventative services, we really have to be able to say what it is we're preventing and how we're preventing it and what the likelihood it is. So again, all this scrutiny on us is saying, well, refine what you're saying, prove what you're saying, show what you're saying. We can't just be throwing these terms out there and saying come in once a month for preventative massage, bill for it as preventative, and we have nothing to show for it. Each case is obviously different, and so I'm just throwing this out there saying, this is a challenging environment, and it's not going to be as simple as providing wellness and providing medically necessary definition. Now, as far as extended health insurance coverage, and so what we've been alluding to in all of this is that it's not a right to be covered by extended health insurance as a profession. We don't have a right to be able to bill insurance companies. It's a privilege. And it's a privilege that we earn, and it's a privilege that we show value for the services that we provide. So it's just a bit of a change of mentality that we need to shift as a profession. So I want to go into the professional practice group. So any questions around these issues? I know, I'm sure some of you have some philosophical brewings about some of the stuff that I've said, so I encourage you to leave that and we can have a discussion, but any direct questions?
Hopefully this is okay. When you were talking about the insurance companies asking for a 4-page form regarding a patient's treatment plan, are we legally allowed to give out that personal information without a consent from the patient?
No. You have to have a signed consent from them. And that's the other issue too, is just like an ICBC adjuster calls you up and wants information from you, you have to have a signed consent from your patient to release that information. Same with extended health insurance companies, but most patients, when they submit their claims, they sign an authorization, and the adjuster should be aware of that, and all you need to ask them to do is to send over that form, and off you go. You're fine with that. But absolutely, that is definitely a major issue that you need to be considering when you ask for the information. And by the way, with that 4-page form, we did, with our insurance connections, we did work through the national organizations to get to that insurance company to let them know that this is not a reasonable request for that therapist. And so it's one of the things that we're working through and trying to create a more simplified mechanisms for insurance companies to get what they need, so our patients get paid when they need to and as quickly as they need to, and we get paid from our patients. So it's in everyone's best interest to work together and try to find a solution to what we're facing.
Sorry, just to clarify that point on the authorization, if your patient has subsequently retained counsel, don't rely on the authorization that ICBC sent you previously, because that will be revoked as a matter of course. So don't send out records if you know they've got counsel. You don't send them to ICBC anymore. That authorization is null and void in most instances. So you need to confirm it. Just be careful.
Yeah, most lawyers I know in my practice anyway send you that revoke of authorization, but some don't. So, great. So, our professional practice groups. there's been a lot of discussion over the years about specialization and creating opportunities for RMTs to move into new areas. And so what we did a couple of years ago is we created a white paper around what the association sees as their professional practice groups and what their role are, and in hopes that down the road, once that field within the profession is developed enough, we can start to create specializations around that. But until that point, until we have the development within the profession itself, to go to the college or go to the government and ask for the ability to grant specialized areas would not be reasonable. And so the professional practice groups are a way for us to start developing those specialized fields within our profession and in advancing the profession. And right now we have 2 groups that are functioning, and that's sports, and I believe, Anita, you're heading that up now. And we have a women's health group, which we're just sort of switching people that are running that group right now. And so the objectives that we have, there are 7 objectives, and I'll just read them quickly out to you. And they'll sort of explain to you the rationale and reasoning behind them. So first one is to provide a forum for the exchange of ideas between those interested in a particular clinical practice area. So what we're interested in is a clinical practice area, not a technique practice. So we're not interested in developing specialization around fascial therapy or trigger point therapy or craniosacral therapy. Those are courses you can take, and actually our philosophy is that no one treatment modality is going to stay stagnant. It's going to be continuous as far as creating a specialization around it. Some techniques will ebb and flow. They'll be popular, they won't be popular, they'll fall off the bandwagon, etc., or new research comes up that shows other techniques are better than the ones that we learned 20 years ago. So creating specialization around techniques is really not a feasible thing. We can create interest groups around them, but creating specialization around them is not a feasible project. Number 2, second objective is to develop clinical guidelines and standards of practice for those working in a particular field of specialization. 3, to promote and facilitate the development of high-quality postgraduate continuing education courses. 4, to encourage research and development that will enhance the research base of massage therapy. 5, to develop and maintain links with other relevant agencies. And 6, to promote the benefits of the field to other massage therapists, healthcare professionals, and related agencies, regulatory bodies, so the field of that specialized field. And to allow individual RMTs to be granted a specialty designation. So that is what we're working on. So if you're interested in the sports, Anita is the one to talk to, and women's health, you can contact me or the office. And once we know the transition of the leadership in that group, we'll be able to direct you to that. The sports, the women's health group does have a Facebook page if you're on Facebook, and if you just go MTABC Women's Health, you'll find it.
And we will by mid-December.
And the sports group will be, yeah. If any of you are connected to my profile on Facebook, then I put all that stuff up in there. Yeah. So, any questions around professional practice? Great. And then I'm all done.
Well, thank you, Bodhi. I just want to do a quick closing here, and I guess one of the most important things I wanted to say to you is that the association it belongs to the members. We're really there to try and help your business thrive as best we can. We truly do want to hear from you. If there's something we can do that we can do as a collective that can support everybody, we're happy to do that. We actually even do things specifically and individually for members, and we're happy to do that as well. one of the things I would like you to all consider is that if there is time, if you feel you'd want to be on our editorial board or anything like that, we'd certainly like to hear from you. We're always looking for members to help support us with different little projects, project-oriented things that we're doing. I know our members helped us a couple of times, and so I thank them for that, and hopefully others will join in. I also, in your package, want to draw your attention to this very nice piece that Dave did. It's called Great Values for Membership. Just to, and the reason I'm doing that is because I think a lot of members actually don't know everything that the association does. I don't think I know everything the association does, but that's another story. It kind of lists off a number of areas that you might be interested in, so sample contracts. Our website is just packed full of information for you to use in your clinic. And if you go on to the members side, you'll see no end of information that you can use and participate and download easily. I don't know if Scott mentioned, but on the website we actually have a privacy policy that you can watch the video. You can sit any one of your staff, or if you have staff, and your associates down, and they can watch the video. It's Scott as the talking head, but he's lovely. And then you just download the form, they sign it, and Bob's your uncle, you're done, you're covered. And that's specifically for your WorkSafe agreement stuff, but you can use it just as your privacy policy piece. Research, all of you know, I'm sure that you can contact Bodhi through the office. There's Bodhi's there 3 days a week, and we're looking at hiring a librarian as well for that position. What else can I tell you? I do want to also draw your attention to the insurance piece. I know Harry's talked to you a lot about it today, but there's a couple of places that I think members aren't always that aware of, and that we do have a travel policy. So anytime you're traveling, if you're going down to Seattle for the weekend or whatever, you just go to the website, you download the policy, and you're covered. It's pretty simple. I've got it right, Harry?
Just download the card.
Just download the card. It's right on the member side. Every member of ours is covered. That's something new we added 4 years ago. But I feel like I have to tell people, because I was actually talking to somebody in this room who will remain nameless and who travels a lot, and he didn't know we had it, so it was interesting. There is identity theft. You're all covered for identity theft. All of our members are covered for identity theft. And this year we started the life insurance policy for all our members for $10,000. So those are just some of the things I wanted to draw to your attention. The other piece that Dee was reminding me, in case there's any more questions around the occurrence versus claims made insurance, you can talk to Harry. Harry will be around for a little bit, and so will Scott and Jason, as well as Anita's here. Stick up your hand, Anita. And Damon, you know. Dee's in the back, and Aaron and Bodhi, Dave, Terry. You can ask any one of us any questions you want during the lunch, or if there's something specific you need assistance with, we're happy to do that. The other really quick thing that the association will do for you, and we're happy to, if you're having in your community health fairs or anything of that sort, or you're going out as a clinic business to participate in an event, please let us know about it. All we ask is that you take a picture of it, and we'll send you everything we possibly can. We have portable tables and portable chairs, and we have pull-ups and giveaways. We've got all kinds of stuff that we're happy to send out. We'll even pay up to $200 for your participation in an event if it's a health fair, because we really see you as a front line promoting the profession. So please let us know about that. And I just want to also mention two things. We're getting close. I think it's May 13th. There's going to be a provincial election. I'm going to also be calling on some of you to help us with that lobbying effort. We will be having a lobbying effort that will be formalized. Specifically, we're going to be talking about scope of practice definition. That's what we really do need to get through politicians' heads. We need that definition changed, because if you read it, it's a ridiculous definition that currently we have. So we need to get to the politicals and everybody else that will listen to us on that. But there's a number of issues just being visible. So we'll be talking to you by email about those things. The other thing I will ask you to do, or first let me just tell you my takeaways, and if you've got more that you want me to take away, you can grab me and tell me what they are. So we're going to get clarification. Somebody mentioned around that whole gift certificate thing. We'll get that and send that out to you. I think that's an important piece that we need to do. The sexual harassment policy, I think Jason mentioned that. I've asked Scott to develop a policy for us, for you, that you can use in your clinic, and we'll get that out to you as soon as that happens, probably early in the new year. We'll get those changes, as I said, made to the template agreement and get that out to you prior to it going up online. And I guess the other thing I want to ask you is to please complete the evaluation form. You should have it. It's kind of a, I don't even know, kind of a goldy colored form in your package. We'd really like to get some feedback for what you think about the day. And the other question, I don't even know if it's on there, if you could let us know if you think it was valuable that we hold another meeting. We sure ran through a lot of information in one short morning, but we'd like to know if you'd like to do this again. So with that, I will again thank you, and now we'll go on to the more casual part of the meeting. And I think lunch is served where, Dee? Is it? Oh, lunch is at the back, and please stay and chat up your colleagues. Thank you.